What's up, everyone? My name is Geselle. I am from Geselle on YouTube, and today I have a very special video. I have Jamie Lyn here. She is another YouTuber sonographer. She is absolutely amazing. One of the reasons why I started my YouTube channel. And I'm so happy that she's here with us today for you guys. She is a MFM sonographer. She has a ton of other registries as well. And I am just so excited for her to be here. So I'm going to let her introduce herself.
Hey everyone, I'm Jamie. I started my YouTube channel 2 years ago. I've kind of been off and on here recently, but I've really dove into ultrasound. I started off doing vascular and general, and I knew that was not where I wanted to be. I knew I always wanted to work in OB, but destiny led me to MFM. So that's where I'm at today.
I love that. So you can do general, vascular, and OB, and MFM, so you can do everything, which is really cool. What are your registries in?
So I have my RVT, which is vascular, my ARDMS, which is just the general, and also ARDMS OB, GYN. And right now I'm studying for my fetal echo.
Ooh, that's so cool. We do have a lot of students in my Discord community that actually ask about fetal echo and pediatric echo. I guess a point where they're confused about is when you want to do fetal echo, how do you go about that? Do you have to be a general tech first? Because how do you do that versus, going to echo program?
To my understanding, you have to work in MFM to get fetal echo. Okay. I'm not 100% positive on that, but just like with any of your other registries, if you don't have them right out of school, you have to have on-the-job training and then somebody sign off on your CV form in order to sit for that registry. To my understanding, that you have to be an MFM to do that.
Okay, that makes so much sense because what's included in the fetal echo? Is it like the whole heart echo and the outflow inflow tract stuff?
Mm-hmm. So with fetal echo, I do echoes every day, which hopefully that helps me when I do my registry. Yeah. But, we look at overall baby, where, I usually start at the head, and we look at all parts of the brain, work our way down to baby's feet. But when the chest is up and we're looking at baby's heart, we look at like you said, the outflow tracts. We look at the RVOT, the LVOT, fourth chamber, because the fourth chamber will tell you a lot about the baby's heart before even diving deeper into looking at it. We look at the 3-vessel view, the 3-vessel trachea view, aortic arch, ductal arch. I mean, we literally go deep into the heart and how the muscles contract and everything.
Wow, that's amazing. I mean, I have no idea how to do echoes. And then on top of that, I did clinicals in a hospital, so I didn't get to go to a high-risk OB clinical site. Did you?
No, I did not. In fact, the school that I went to didn't really have a whole bunch of OB. Most of our OB scans that we got to do, we basically had to reach out to people and see if they're willing to come in and let us scan them. And luckily for me, when I was going through school, 2 of my friends were pregnant, so we get to scan them. Oh, but I had no OB experience until I got into the hospital that I work at now.
And then they taught you OB on the job? Like, were you going to take it at the same time?
Yeah.
Really cool. Really cool.
Yeah.
Wow, that's so cool. Because we have a labor and delivery, but we only do limited OB exams. At your hospital, do you guys do limited, or do you guys do like a full complete anatomies?
So when you're in the hospital, unless you are MFM certified, that's the way our hospital works. You are doing limited. Like you said, we're normally first trimesters, and if they were second trimesters, we'd send them up to labor and delivery, which is all MFM sonographers. So
that's cool.
Prior to me getting into MFM, all I knew was first trimester. I didn't really know much of anything else.
Cool. And they taught you all on the job. That's great.
Yeah.
I mean, a lot of students also are confused about that. Do you have videos on your channel about how to go about MFM?
No, I kind of talked about it on a video before, and here recently I've been doing a lot of brainstorming because I've kind of not been recording videos. And I'm like, you know how you get kind of like brain fog and you don't know where where to even begin again. So
well, I know I'm like brand new to this whole world, but I've seen a bunch of your videos, and you have a lot of videos that are really going to help students. And even though, you've done them before, they're still relevant and they're going to be relevant.
yeah.
I don't know if you saw that viral TikTok that is going around, but there's a viral TikTok of a doctor. He has a PhD, and he was explaining sonography. And so many people are looking up ultrasound right now on YouTube. So I 100% guarantee they're going to
That's
see your
awesome.
channel. Yes, I know. And you have a ton of life of sonographer videos, interview questions. I mean, what inspired you to start your YouTube channel?
When I was going back to school for ultrasound, and then more so when I got out of school and I was looking for a job, I couldn't find anything on sonography. And I'm like, I don't even know where to begin. I don't know what kind of questions they're going to ask me. I know nothing about ultrasound other than what I learned in school. So I was like, when I learned firsthand, I just thought it would be great, because if anyone was like me, they're going to be looking for that information. And I just felt like, hey, let's try this. And I had some friends who are nurses who did the same thing. So I was like, well, if they can do it, I can do it.
That's so awesome. When you were in school, were you already a mom? Like, did you ever have kids and stuff? So how did that go? Because a lot of people ask about it all the time, and I'm like, go to Jamie's YouTube channel.
Thanks.
How did you do it?
It was really hard. I get this, you're right. I do personally get this question a ton. And sometimes my inbox is overwhelmed. Like, I try to respond to everyone, and sometimes I get back to people and I'm like, I know it's been 2 months, but I'm here to answer your question.
Oh, at least you do respond. And I mean, people understand we're busy.
Yeah. And then being an MFM, I work Monday through Friday. So anything social media related is crammed in, and typically on Sundays. So like I said, it was really hard being a mom and going to school and working, and it can be done. I mean, for instance, you know how hard school was. Your day is like nothing. You eat, sleep, drink, ultrasound from the time you wake up to the time you go to bed. And then that 2 years, unless you went for your bachelor's, that 2 years is so fast. And the next thing you know, you're out in the real world getting a job.
Yeah. It's insane. And I always tell people it goes by really fast. I mean, if you really want it, you can do it. And definitely your kids are probably like one of the biggest motivators in your life, to be honest. I don't have any kids, so it's so hard to like, tell people how to get through their program, but I always like share them with your channel. And then also Tamika, she's got kids. It is possible to do it with kids. It's just probably a little bit more harder.
Well, it was really hard. I would take, because my husband and I well, at the time I was only working part-time. I worked in a dental office when I was going to school, and I was so blessed that they worked with me, but my husband worked shift work, and was gone like at nighttime. So he would drop the kids off to me at school, and they would stay in the lab, and I would even scan them to get my hours and everything. So our sonography group, the sisters that we went to school with, we really were a family. We took care of each other's children and watched them while we were taking tests and so on and so forth. So
were you guys a big group? Was there a lot in your cohort?
We started at 23. I think we graduated at 19.
Okay.
So we had a couple of men in our group that ended up wanting to do respiratory, so they ended up switching programs. But
that's cool. You guys had respiratory. How was your degree? Was it an associate's?
Associates of Science.
Okay. You went for general, and it included vascular?
So the school offered like the whole round of DMS, so like they taught us everything, but OB was very, very limited as to what they could teach us. We only had one OB teacher, and she ended up getting pregnant, and she left after we graduated, thankfully. They taught us everything, and our tuition included our registries. So we got our SPI before we graduated, and we got 2 registries before we graduated. And if you wanted to get your third, you obviously came out of pocket for that one. And then any other after that is on you too.
Oh, wow. Because my program did not include registry. So we paid for everything out of pocket.
Hopefully you found some place that will reimburse you.
Right, I know. It is a lot of money to get those registries, but definitely, we're all proud to have them after our name.
For
So, with
sure.
all of that, before we get into questions, did you have any advice for anyone that's looking to go into OB or MFM?
All I could say is I don't know if schools offer, like, I know that one of the schools here and where I'm at, they offer more OB than I actually got offered.
Hmm.
So if OB or MFM, going into it, that's where you want to be eventually, definitely focus on OB and try to get a job in OB. But just like I tell everybody who asks me, as a new sonographer, when you're getting a new job in the career field, they want experience. So use your school as experience. Well, put it on your resume as your experience.
Hmm.
And then on top of that, take anything that you can. Obviously, if it's conducive with your life, but at PRN position, sometimes you got to suck it up for a year and learn as much as you can and work those horrible night shifts
Yeah. Oh, yeah.
to get to where you want to be. So
Mhm.
that would
Awesome.
be the best advice.
Yes, definitely. Look into OB because I don't know how you guys do it. I give you mad props and applause and praise because OB is so hard for me.
It was super hard for me too. But now that I've got it, it's like I can do it with my eyes closed.
Right, that's so cool. Ah. Okay, so I asked the community on Instagram and then I also asked my Discord community what they want to know from you. So obviously we're gonna send everyone to your YouTube channel, but we're gonna go through some of these specific questions that they want to know. I know you touched on it a little bit, but they asked, how did you become an MFM sonographer and what was your path during and after school to land your position?
So, like I said, I just took what I could. When I first got my first job in ultrasound was doing transcranial Doppler. I know, completely different than what we do,
Nice.
do now. But it does help me a little bit because I do MCAs on fetal heads. Yeah, so it does help. But I did that, and then I was lucky because it was a traveling job, so they paid me really well. But then I knew that's not where I wanted to be, so I went to PRN, and then I found another hospital that literally taught me everything, and then offered me the full-time position. And it was actually on accident. Yes. They were like, hey, we have a full-time position coming available. Make sure you apply for it. Well, the only full-time position that I saw available was MFM sonographer. So I was like, okay, I'm going to go ahead and apply for it. So my
Mhm.
manager calls me and she's like, hey, did you mean to apply for the MFM position? And I was like, no, I thought that was it.
Oh my
So she goes,
God.
well, would you be interested? And I was like, please.
Wow. Oh my gosh, I love that.
So
I feel like every story that I've heard so far from, people, it's all kind of been luck or chance but I truly believe everything happens for a reason. So,
absolutely.
that's amazing. I love that. So what is the difference between MFM and OB? People are curious and, what makes it different?
So I try to, I don't like to say like too much because I don't want it to sound like a snobby kind of answer because
Right.
it's definitely not. I think, like you said, OB is definitely challenging, and MFM takes it a little bit further. I know a lot of OB offices don't have sonographers. The doctors will scan their patients. But with OB, you're looking at more OB and GYN, to my knowledge. I mean, there may be somebody who could answer it better. Uh, but with MFM, and I get this question from patients a lot too. They're like, why did my doctor send me here? They do ultrasounds there. And I'm like, well, for instance, you have advanced maternal age or gestational diabetes. So we're going to look more in depth at baby's brain, the heart. The heart's the biggest thing that sets us apart, is because we're trained to look at every valve, every leaflet, like
Mhm.
everything. So it's really in depth, and that's what patients will tell me. Y'all are way more thorough than at my OB office, but that's just because we have so much more to look at. So
Yeah.
I try to answer that with caution because I definitely don't want to offend anyone.
No, no worries. I totally get it. But it is separate for a reason, so
Yeah.
people have to know that. But I know a lot of students who go in thinking, about MFM, but really I feel like you need to have a little bit more experience to get into MFM. Yeah.
Yes.
Okay. So what are some of the things that MFM sonographer says while they're scanning the patient? Like, are they completely silent or do they point out things that they're looking at?
It's just like with any other ultrasound, except for we're trying to make it a good experience for mom, because typically mom is coming in because they're worried about their baby. They think that there's something wrong, which sometimes there is something wrong. Most of the time, baby's completely fine, and we're just making sure baby's fine due to mother's and father's health history. You know, we just talk to them. We're friends. We we get to know them, ask them if they have other children, if their babies are excited. We get a lot of patients who are IVF who've been struggling to get pregnant. So you definitely are just trying to make it comfortable for them because they've had so many ultrasounds. When I'm scanning, I'm like, oh, we're looking at baby's head. And if I measure something, I'm like, we're like, for instance, like the lateral ventricles in baby's brain. We measure I tell the patient, we measure the lateral ventricles, they store fluid. We just measure it to show the doctor, you know, because we do need to know if it's in the upper limits or not. We measure everything, and I tell them what I'm looking at, but if there's any pathology, I just keep my poker face.
Right.
So.
Yes, that's definitely the next couple of questions. We'll go over that after, but you said that you become friends with them. Do you get patients throughout their whole entire pregnancy? Like, yeah.
The office that I work in, there's like 13 of us that are sonographers, and we have our own little room. So it's kind of nice because we can go back if we see something crazy. We can go back and like bounce it off of each other, or like a returning patient. Hey, did you see this patient last week? Can you tell me what you saw? What am I looking at? We do see patients, and depending on their circumstance, whether or not they, I don't know, gestational diabetes in their late third trimester, we'll see them weekly or twice a week, or, you know, we just see them a lot. And sometimes they ask for us to see them again, but usually they love everyone in our office.
Oh, that's awesome.
So,
It sounds like a really great office to work at. So then what does your daily schedule and typical day look like? Like how many patients would you get in a day? Sounds like you guys have cool machines too.
Yeah, we have 12 rooms. So patients come in, it's a lot of ultrasound. But we get patients in. So basically, depending on whether they're a new patient or not, we'll get the chart after the patient's worked up and put in the room. We go through the chart, we look at their health history, what they're being seen for, just to kind of figure out what we're doing for that scan that day. We'll go in, scan the patient, and then we are responsible for typing up the report. We type up the report, and then we bring it to the doctor, and we let the doctor know if we saw anything abnormal or if everything looked good or not. And then the doctor goes in and talks to the patient. So that's pretty much what the day looks like. I'll probably see about, it all depends. I would say on a busy day when we have multiple doctors, and like I said, there's like 11 to 13 of us every day. So we'll all see about 7 patients a day. So we see a lot of patients.
Yeah. Yeah. Oh my gosh, so amazing. I mean, I come from a big hospital, so we have like 6 to 7 people on a shift. But I do know many places only have like 2 sonographers, sometimes just 1.
Yeah.
So knowing that you guys have 12 rooms, that's a lot.
Yes.
Do you get an hour allocated for your patients, or, I mean?
It really kind of depends on what they're being seen for. So if they're coming in for their weekly BPP, their biophysical profile, then their appointment is probably about 45 minutes long, but we only get a very short period of time, like 30 minutes with them. So it's not rushed. I know it sounds like it could be rushed, but it's definitely not rushed at all. But basically, when you're doing a BPP, you're just going in to make sure amniotic fluid looks good, heartbeat and breathing and movements, you know?
Oh, I see.
So, and then like growth exams, about 45 minutes. And then anatomy, we get about an hour to an hour and a half, depending on if they're multiples or not.
Oh my gosh. Have you ever scanned triplets?
I've scanned quadruplets. That's the most I've seen.
Oh my gosh, that's crazy.
And it's heart-wrenching because it's like, I got to be in there how long?
Oh
This
my
poor
God.
mom.
Wow, I know. I mean, I just cringe when I get twins. I'm just like, on New Year's Eve, I had 2 moms, both with twins. I was like, what's happening today?
I say it's a symptom of COVID. Like everybody's pregnant all of a sudden with multiples.
Right. Well, props to you. I can't believe you did that. 4 babies. So this kind of goes back to what we were talking about earlier. What do you do if you find an abnormality or no heartbeat? What's the line of how much you can tell the patient? So if you see like a first trimester fetal demise, and if a patient's like asking for heartbeat, what do you say and like what do you do?
Again, it kind of depends on how far along mom is. And a lot of the times they know prior to coming to us because they've already seen their OB that day and they know that something's going on or that they're miscarrying. They kind of have an idea. It's really tough though, because sometimes they don't, and you go in and you get like a first trimester, right? You're coming in for your first trimester screening and you get a crown rump length, but you don't see the flicker in baby's heart. So you're like, you look at the uterus, you look at the ovaries, the adnexes, and then you get your crown rump length, and then you try to get a heartbeat and you take a picture to prove that there's no heartbeat. But the patient, like I said, sometimes they have an idea and they're already crying. And so you feel uncomfortable being in there because you want to hug them, but you don't, you can't.
Yeah.
And so you just kind of get in and, do the exam. And then, you let your patient know, hey, it's gonna be okay. The doctor will be in here shortly. I hope you have a good day. And then you just leave. And it's really kind of hard, but wearing masks help.
Right. Well, the masks have totally helped our
So,
poker faces. And someone asked, how do
yes.
you maintain your poker face? So, I mean, I know you probably see a lot of crazy things or sad things. And how do you go about that?
You really just kind of focus on the job that you're doing at that time. And that helps. But also too, I think the hardest part is like, I'm sure you've seen those memes where they're like, how I look, how I think I look, and then how I actually look to the patient.
Yeah.
I'm like so grateful for the mask, because when I see something that's crazy, I'm sure my mouth is just wide open and I'm like,
Yeah.
so it's really just trying to just focus on what you're doing. And I tell the patients too, sometimes I tell them, like, if I get really quiet looking at baby's heart, don't worry. I'm just really focused on making sure I get everything I need for the doctor. And I tell them that before we even get started. So sometimes they think it's just a part of it, but even though I might be tripping out, like, oh my God, this is tetralogy. Like, it helps if you explain the procedure, what you're going to do prior. Our hospital requires this because I don't know if I've explained this, but I work in a clinic that's attached to the hospital. So I'm hired from the hospital, but I work in the MFM clinic. They make us do what's called AIDIT, and I'm sure a lot of hospitals and places do the AIDIT. So we go in there and we basically explain the exam. But when you're dealing with the fetal portion of it, I think it's best to kind of give them the heads up, because not all the time as a sonographers, we sometimes don't know what we're looking at. It could be like a complex heart defect and you have no idea, you've never seen it before. So you're probably literally gaping mouth and eyes wide looking at this. And if they know that it's because you're really focused, and they won't think twice about it.
Smart. Yeah, we do AIDIT, and I did do a video on it, how to approach a patient. I basically went through the AIDIT process.
That's a great idea.
Yeah, you should do it too, as
I
a
should.
sonographer. So, so then I know you see a ton of sad things. I mean, have you ever cried on the job?
Yes. Sometimes it's really hard to hold in that emotion. So sometimes, like, what it happens, and like I said, there's a bunch of us, so we go back in the room and we're there for each other. I've seen a baby that there's no way this baby was going to make it, like, had high drops and a bunch of heart defects, and you're just like, it's sad because you know that baby, that mom has tried so hard to get pregnant or whatnot, and then they're not going to have the baby that they tried for, so it really is gut wrenching, and you basically hold it together till you get back in the room with your friends. And then I've seen some of us just break down and cry, and I've just teared up and just sat there and did my thing. But
It is
it can
hard.
be tough.
Yeah.
Yeah.
But and not even just in OB too. I mean, in general, and even echo. Some people scan the heart for their last time.
Yeah.
When they get called to those code blues and stuff like that. I mean, it can be difficult. So, and we are human. We have emotions, and I don't knock anyone who do cry or who feel for their patient.
Right.
That's what we do.
It's good because, like, as sonographers, I feel like if you don't have compassion for patients, then you shouldn't be in the career field. That's our job, is to help people. And the moment that your humanity doesn't show in your job, then it's time to hang up the probe.
Right. Right. That's
So
totally true. I think that's totally true. Because sometimes we can turn into robots, honestly. So you got to
I think so too.
keep your head on the ground.
Yeah.
So what's the most difficult part of the job?
Would be fetal demises. Also, too, and this is, I could tell you a couple of things. Our job's very demanding, and you know that as a sonographer. And so sometimes it's hard to leave work at work. So that's pretty hard. Another thing is like some patients don't understand why we can't get the best pictures. I mean, ultrasound ability to get what we see is amazing, but it also is a lot of work. So like you have high BMI patients and you want to get them beautiful pictures, but you can't. So it's just like kind of put you in a hard spot. So you can only try your best.
Always try your best. So then what do you enjoy the most of your job?
It's as cheesy as it sounds. One, I just love scanning ultrasound. I do. But the fact that you are saving a life.
Mm-hmm.
I know like with MFM, you're like, people are probably like, how do you save life? Well, because we could have caught something that, and with technology these days, like if you caught like a VSD that could become worse, you know, like a ventricular septal defect that could be worse. They know to have a pediatric cardiologist there when the baby's born, or if mom has a CRETA or placenta previa, that's monitored so they don't bleed out when they have baby. The fact that we can successfully, or we can help them successfully have a successful pregnancy,
Mm-hmm.
that's the best part about it for me.
Oh, I love that. I'm getting goosebumps just because I know what you're saying. It's like, it's crazy, you know? I mean, for some people, they probably don't understand what some of those things are, but when you do, it's just like, wow. Yeah. Because
Yeah.
those are hard things and you got to follow those. So I give you
Yeah.
props. And I love that sonographers
Uh,
love their job. I mean, everyone
yeah.
that I've talked to pretty much loves their job. I mean, why wouldn't you, go into something that you love to do?
Right. And I mean, I wish that we got as much credit as the nurses did or
Yeah,
do, but that's
right.
okay
Yeah,
because
I
my
mean,
job is good enough.
right. That's what makes us different. I mean, you already know that a lot of nurses don't like their jobs, which is also
Yeah.
unfortunate. And then a lot of
Right.
people do tend to go into it just for the money, which I'm not saying all of them do. But
Right.
we are definitely a small group of people. And like, I know that I'm sure most sonographers in different states and cities, like, they all pretty much know each other or went to school together or have met through similar friends and colleagues and so
Right.
I mean, here in Vegas, everyone kind of knows each other, and
Yeah.
I can only see it growing from here on out. But I do hope that people see we love our jobs and we love our career, we
Yeah.
love our patients, and enjoy doing what we do. So people who go into it
Yeah.
hopefully will also have that mindset. I
Hope so.
hope.
I hope that like, I mean, we do make good money, and I hope that people aren't going into it for the money because it is demanding.
Yeah.
You got to really love what you do, and because you're not rewarded.
No, no, exactly. You're just gonna feel like, eh. But at the same time, it's definitely challenging, and I think Leah called it in our last video. She said a secret society, which I
Yeah.
love so much because we all can relate to one another. And I mean, how many years have you been doing it now for?
Let me count. I think it hasn't been too many. It hasn't been too many, but
Mm-hmm.
it just has flown by. I mean, I guess when you're having fun,
Yeah, exactly.
not including school. 5 years.
Yeah. See,
Yeah.
and you're still enjoying your job. I mean, and
Yeah.
I'm sure you know techs who've been doing it over 10 years who still enjoy doing what they do.
I work with a couple older women who have been doing it for about 25, 30 years, and
Love,
they still love it. So
that's awesome. And we'll see if that'll be us one day.
yeah.
I'm sure it will be.
Yes.
So, this one was a good question. Do you have any recommendations or suggestions for when males scan OB patients? Because the student said, I know it can be awkward for both parties at times. I mean, I get a lot of questions about the male sonographer.
Mhm.
And I honestly, in our hospital, we have 5 male sonographers, and then in the valley in Vegas itself, I can name over 10, 15 male sonographers.
Yeah.
So, I mean, it is a job that males can do as well, but how about in the OB MFM scenario? I mean, what do you think?
So I have two male sonographers. I'm trying to think, they might be the only male sonographers in the whole hospital and in my hospital, but they're both MFM. And one of them works on the hospital side, so he does his general vascular and MFM when needed to be. And the other one works in the clinic, and he's actually our educator. I think the hardest part for a male sonographer in OB and MFM would have to be that cultural wise, like some cultures do not want a male sonographer. They want a female sonographer. That would be the hardest part of that, I would think. And then like if they're doing a transvaginal exam, if we're checking cervix or whatnot, most places require a chaperone, but even if you don't require a chaperone, get yourself a chaperone. It makes it easier for you and more comfortable for you.
Yeah, and I don't know if many male students know about that before they go into the programs or anything like that. But if
Yeah.
you do a vaginal, typically they do have a chaperone. I've even seen in my outpatient place, some women who do testiculars, they have a chaperone as well. I mean, it's for just comfortability, safety, all that good stuff. I mean,
yeah.
how did you study for your boards and what material did you use? We're coming up on the last two questions.
So for me, I have a hard time studying. It's just reading things, and I love to read, but reading like books, like educational books is just like, it's so boring. I'm a hands-on type of person. So for me, I use ultrasound registry review, and I mean, you pay for it, but I just take the mock exams over and over again because you're going to learn and you're going to see those questions. And the questions that are on ultrasound registry review, it's a mouthful. I've actually seen them on registries before. They might be worded differently, but you'll get in there and you'll be like, I know this question, you know. Then depending on what you're studying for, everybody's got a different way of studying. Like I have my book here, my Echo, and this is one that was recommended to me. I like to use the book specifically just to look at pictures. The more you see, the more you understand what you're looking at on the screen. I would say for me, ultrasound registry review would be the way to go.
A lot of people on Facebook groups they 100% stand by them, helping them pass the registry. So that's really cool.
Yeah.
And is it affordable, would you say?
Yeah, I mean, so there's different plans for what you want. So I think it usually goes like a month. You pay for the month, and I want to say the one I did for Fetal Echo is like I paid like $150 for it. So you get like the whole like review, and they do it in bullet points. So instead of reading the book, you got the whole book, but it's in bullets. And then you get 4 or however many you choose mock exams plus a post test that will give you your CMEs once you pass that. And also the click to learn. So you answer the question and it'll tell you right away why that's the answer or why it wasn't the answer. So I would say it's pretty affordable. And then if you are coming up at the end of the month and you're about to expire, it's way cheaper to extend while you're still on there. So, and they're money back guaranteed. If you don't pass your test, they'll help you out.
Nice.
So.
Well, thank you for all that information. I appreciate you being here today. The last question pretty much you answered earlier, which is like if you had any advice. I mean, is there anything else you want to tell everybody about MFM or ultrasound in general?
Oh, that's a tough one. If you see my phone, I have the questions down and I didn't even answer it on my phone.
That's okay.
I answered all of them except for that one.
It's
but
okay.
I guess with ultrasound, I always tell people, scan as much as you can, especially students. Like, I know you're scared to grab the probe and scan, but just do it anyways, because the more comfortable you get with it, the better it is. And if you're wanting to do MFM, like I mentioned earlier, just focus on that goal and learn as much as you can about it prior and apply. I just applied for everything. I was just like, oh, I want this job. I'm going to get this job.
Awesome. I know there's a ton. I mean, I look on Facebook groups all the time. They're posting shifts and jobs. I mean, jobs needed. It's definitely needed. And I think it's going to keep growing for the next couple of years.
Yeah. And, that brings up a good point because they always do have job postings coming available. And most of the time, and this is what students should understand, is we all start somewhere. And most of the time, these jobs that are coming available is because a student who got their first job and was night shifts, and now they're tired of night shifts and they got offered a day shift. So now there's a night shift available. It's okay to take that job. The night stuff, you'll see the crazier things. It's a little slower, so you can learn while you're doing it and take your time doing those scans. Everybody's got to start somewhere. Take those night shifts and then get in there and find what you want to be.
Yes, I mean, yeah, take what you can, and any experience is experience. I mean, you can't really learn unless you're out there scanning, and especially on your own. I remember after clinicals, when I got my first job, I would take those call shifts, and while
Yeah.
they suck so much, I learned so much during those shifts.
Yeah.
So,
And like you said, you're on your own, so you get to call the radiologist and be like, this is what I'm looking at, but I don't know a thing about it.
exactly, and they'll talk to you.
Yeah, they will. I mean, sometimes you have your radiologists that don't want to have anything to do with you, but that's in any job, I think. But
Yeah,
just don't be scared.
I know, like, get over those fears and like do your job, do your best. That's really all we can tell everyone. And with time, they will also learn after a few years how it goes. But thank you so much for being
Yeah.
here. I appreciate you so much. I hope that everyone learned something on this video. I'm sure they did. And I want them to go to your page and your Instagram so you can let them know where they can find you.
Awesome. Well, you can find me at Jamie Lyn on YouTube. And then on Instagram, I'm at Jamie Cadena, Jme Cadena, Cadeny.
Yeah.
I can't even spell today.
Jamie Cadena, yes, I will put her information in the description box below. Apparently, not that many people look at description boxes, apparently, but we'll get them to look at the description boxes, go to your pages, and I appreciate you so much.
Yeah, thank you.
Hopefully we can get you on another video in the future. Hopefully we'll see some more videos from you in the future too.
You will.
And then I know maybe you got some stuff from this video to talk about in a video. So I know mom life is busy, and I mean with your job too, I know it's busy. I mean, I'm about to start working 5 days a week for the next 3 months. I'm just covering for someone who just gave birth the other night.
Oh.
So so yeah, I'll definitely be busy the next couple of weeks too. But thank you so much for being here.
Thank
I
you.
so appreciate it. You guys don't forget to hit the thumbs up button on all of our videos, her videos too, when you go check them out, and subscribe to our channels. It was so nice
Awesome.
being here. We'll see you next time.
Yes, ma'am. Bye.
Bye, guys.